I give my consent to be recorded and the video uploaded into a video cloud platform for the exclusive use of assessing this student's competency in the Advanced Health Assessment course at MU.
All right, this is my 37-year-old female patient who I'm going to do head, ears, eyes, nose, and throat assessment as well as integumentary. Starting off the assessment, we're going to be looking at the skull and the face. The skull looks normal cephalic. It's symmetrical bilaterally. I don't see any edema or swelling. Looking at the eyes, the eyebrows are symmetrical, the eyes are symmetrical, and they are tracking me as we communicate. The nose is midline with no deviation. Lips are pink and moist with no deviation. Going ahead and looking down at the neck, if you could lean back a little bit, I see that the trachea is midline with no deviation. Go ahead and move that head for me. I see full range of motion to the neck, no signs of pain, tenderness, or limited range of motion. I'm going to go ahead and have you close your eyes tight. Good. Smile big. Open your mouth and stick your tongue out, left, right. What I've confirmed is that her voluntary muscles are all intact. Her face is moving symmetrically. I see no weakness to either sides of the face, no droop. That's okay. Go ahead. Thank you very much. Now, I'm going to go ahead and start with palpation. By palpating the skull, I feel that the hair is nice and thick and very well kept. I feel that the skin is warm. I don't feel any edema, no swelling, no abnormalities. Going down to the face, once again, no edema, no abnormalities noted. The skin looks clean and intact. I'm going to go ahead and start by palpating the temporal artery. I do feel the pulse. I feel that it is warm. There is no edema. Any tenderness noted there?
No.
Okay, I'm going to start by assessing the temporal mandibular joint. Go ahead and open your jaw and close a couple times. Okay, at the joint, I feel good range of motion. It doesn't feel any popping, no clicking, no pain noted. I'm going to go ahead and assess the lymph nodes. We're going to start with the preauricular, postauricular, occipital, parietal, submandibular, submental, superficial cervical chain, deep cervical chain, posterior cervical chain, and supraclavicular, the big one. I can't feel most of the lymph nodes. Of what I can feel, they're all soft and movable. We're going to go ahead and start an assessment on the eyes. Looking at the eyes are moving symmetrically. I don't see any lag on any side of the eye. We're going to go ahead and assess her light reflex. So looking straight ahead at me, the pupils look about a 3 to 4, regular shaped circle. Her irises look healthy. I'm going to go ahead and look straight at me. Pupils are reacted to light, and they are consensual. We're going to go ahead and check for accommodation. I want you to follow this object. Okay. As I move the object in, I see that the pupils are constricting to accommodate and focus. As I move out, they are dilating. We're going to do the cover-uncover test, the chest for strabismus. I'm going to go ahead, just keep looking straight at me. Okay, no lateral eye movement with movement, so no negative for any kind of strabismus. We're going to go ahead and test the 6 fields of vision. So what I'm going to go ahead is look straight ahead at me. Follow my finger, just your finger, no face. Okay? We're checking all the visual fields, and we're checking to see that she has good voluntary movement of the eyes. Her voluntary muscles are good. I don't see any lag, any deviation in how she looks. Now we're going to test the visual fields. Go ahead and cover up one eye. I'm going to close the same eye. Tell me when you see my fingers in your field of vision.
See it.
Okay?
See it.
Okay, cover up the other eye. I'm going to cover up my eye as well.
See it. See it. See it. See it.
Fantastic. Okay, go ahead and put you down. I'm going to go ahead and check the conjunctiva. Okay, they look clean and intact. I don't see any foreign bodies, any drainage. They're pink and moist. Pulling up the upper eyelids, I'm looking at the sclera. They are white, clean, and intact. No redness, no foreign bodies. The lacrimal glands are working well because the eyes are moist, no signs of dryness. We're going to go ahead and move to the ears. Looking at the ears externally, no signs of erythemia. They look good. No nodules, no breakdowns, abrasions. When I palpate, do you feel any pain there?
No.
I don't feel any nodules, any abnormalities in the skin. We're going to go ahead and assess the ear canal. Looking into the ear canal, I see that the ear canal is pink. I don't see any foreign bodies. Minimal ceramin noted. No drainage. When I visualize the tympanic membrane, it's pearly gray. Intact. I see the iron malleus. and I see the cone of light at 7 o'clock. We're going to go ahead and test her hearing. Because she's communicating with me, or at regular hearing, should be able to hear at regular voice, but we're going to do the whisper test. Please repeat the next 3 numbers that I tell to you while holding up your other ear.
435. 678.
6, 7, 8. And I would assess the other ear on a regular assessment. Okay, now we're going to go ahead and we're going to move to the nose. There's no external drainage. When I look into the canal, I see that the nasal mucosa is pink and moist. The first turbinate I witness is pink and firm. The nasal septum is no deviation, no protrusion, and looks intact. No abnormalities noted. Now, looking into the mouth, go ahead and open your mouth for me. Okay, assessing the teeth. I see that the teeth are white. I see that the gums are pink and moist and cover up the teeth very well. Buccal-mucosa is pink and moist. Go ahead, and I'm going to assess the back. Can you please lower your tongue for me the best you can? Down, down, down. If you can. There we go. Go ahead and say ah for me. Okay, the uvula and soft palate are rising. The pharyngeal wall is pink and moist. Tonsils, I would give it like a +2. No swelling, no edema, no abnormalities being pushed out. Or no drainage. I'm going to go ahead and assess her skin. Looking at just the face and the arm at this time, but I would do a full skin assessment if I was. Looking at her arm, her skin has good turgor, good response, good elasticity. It looks moist. With the dorsal hand of the skin, it feels warm. Looking at her nail beds, they are pink, they are firm. Cap refill is within less than 2 seconds. I don't see any abnormalities, breakdowns on the skin, no abnormality skin growths. I'm going to educate her on skin. When you assess your skin at home, I want you to follow the ABCD. If you see an abnormal blotchiness on the skin or something's new, A is for asymmetry, which means the wound, this abnormality in the skin is not the same throughout. B is the border. If the border is irregular and not well defined. C is going to be the color. If you see multiple colors like brown, blue, black, that's an abnormality. You should have checked. And D is the diameter. If it's greater than the head of a pencil, then you should go ahead and get it checked out. And I think that's it. Head, ears, nice, and throat. Oh, we're also going to go ahead and assess the thyroid gland because I forgot to do it earlier. I'm going to go ahead and have you lean back and put some water in your mouth, and I'll tell you when to take a sip of water. I'll tell you when to take the sip. I'm going to go ahead and take the trachea, which is midline. I'm going to take my 3 fingers and palpate. Go ahead and swallow. Okay, I don't feel any nodules. I don't feel swelling or edema, and from what I can feel, it feels like a good normal size. Go ahead and I think that's going to be it for me. That's the end of my assessment.